How accurate are vitamin D tests for people with schizophrenia? How accurate are vitamin D tests for individuals with schizophrenia? This is an important question, especially since vitamin D plays a role in overall health. Vitamin D tests measure the total serum levels of vitamin D, which includes both vitamin D2 and vitamin D3. These tests help assess whether someone is deficient or has sufficient levels of vitamin D. For those with schizophrenia, these tests are generally accurate in measuring circulating vitamin D levels, much like they are for the general population. However, there are unique factors related to schizophrenia that can affect vitamin D status and how we interpret test results. Research indicates that individuals with schizophrenia often have lower vitamin D levels compared to healthy individuals. Specifically, those experiencing acute episodes of schizophrenia tend to show significantly reduced vitamin D levels. In contrast, individuals in remission or healthy controls typically have higher levels. This suggests that the severity of symptoms may correlate with vitamin D status. Despite these differences, vitamin D tests reliably reflected the variations in serum levels. This means the tests themselves are accurate. However, understanding the context is essential when interpreting the results. Several factors common in schizophrenia can lead to vitamin D deficiency. For instance, reduced outdoor activity often results in less sun exposure, which is a natural source of vitamin D. Additionally, poor nutrition and other medical conditions that frequently occur alongside schizophrenia can contribute to lower vitamin D levels. These lifestyle and health factors should be taken into account when evaluating test results. They may explain low vitamin D levels more than the diagnosis of schizophrenia itself. It is also important to note that while vitamin D tests measure total circulating vitamin D, they do not directly assess vitamin D activity in the brain or its effects on the nervous system. This is an area of ongoing research, particularly in relation to schizophrenia. Vitamin D deficiency has been linked to increased risk of schizophrenia and more severe symptoms. However, the tests do not provide information on how vitamin D status might influence brain function or psychosis. Practically speaking, vitamin D testing can be beneficial for individuals with schizophrenia. It helps identify deficiencies that may contribute to other health issues, such as metabolic syndrome and diabetes, which are more prevalent in this group. When making decisions about supplementation, test results can guide clinicians. However, it is vital to consider the broader clinical picture, including the patient's psychiatric status and lifestyle factors. In summary, vitamin D tests are accurate in measuring serum vitamin D levels in people with schizophrenia. The challenge lies in interpreting these results within the context of factors related to schizophrenia that influence vitamin D status. While the tests do not assess the neurobiological effects of vitamin D, they remain as useful for managing the physical health aspects of schizophrenia.